We are taking interoperability beyond connectivity to true usability, creating a single longitudinal record that's more inclusive than ever, spanning all systems across any care venue. Building upon the foundation of our comprehensive array of network connections and nationwide exchange capabilities, we're adding intelligence to simplify workflows and enhance data usability. With seamless exchange, your clinicians will celebrate data auto-writing capabilities, intuitive workflows, and the ability to identify other venues of care as trusted sources. Today, we will focus on one patient, John Whitmore, and how true interoperability through seamless exchange has positively impacted his unique healthcare journey. John is a 55-year-old male who has been married to his wife Janie for 35 years. John has been established with your organization for many years. He manages several health issues, sees his PCP, and recently has started seeing a cardiologist. While visiting with family across town, John began experiencing chest pain. Fearing the worst, his wife drove him to the nearest ED, a community hospital outside his established network. After the initial workup, he was transferred to the cardiac cath lab where a stent was placed. Fortunately, the procedure went well, and John was discharged home with instructions to follow up in a week with his established cardiologist. We pick up with John's story as he presents for his follow-up appointment. Here you will see how the data from the external organization is immediately visible to the cardiac team, enabling seamless collaboration across various venues of care and organizations. As he engages with his care team, the nurse opens his chart and is greeted by a simplified experience that makes review and reconciliation of his outside patient data seamless. Right away, the nurse can see a comprehensive list of documents directly within the workflow. With seamless exchange, the documents component now includes new enhanced filtering and archiving abilities, as well as the ability to reconcile outside data from the clinician's native workflow. Now that we've taken a look at those outside documents, let's move on to the visits list. We can see how this new visits list will aid the care team in John's chart review by presenting encounters generated from your organization, while also displaying external encounters. This view is designed to give the care team better awareness to which encounter is open in the chart and provide the ability to quickly and easily change encounters generated by simply clicking. John's allergies that were documented in the community hospital have been automatically written into his local record due to that organization being identified as a trusted source. These auto-write capabilities introduce efficiencies into your clinical care team's workflows, reducing the amount of time they spend in data reconciliation. Additionally, your clinicians can still see and reconcile all other outside allergies that are coming from sources that were not identified as trusted. Looking at those home medications, we see the medications prescribed by John's cardiologist here at his established healthcare organization. But also note that there is outside data for us to review. Those medications prescribed at the community hospital following John's stent placement. Seamless exchange is designed to provide the end user an immersive experience reviewing medications using this intuitive side-by-side user interface. In addition, face-up actions enable clinicians to quickly add those appropriate medications to his local record, and conversely, batch discard those medications that are older or no longer relevant, ultimately saving clinicians time and clicks. Let's take a look at the problem list. We can see a consistent experience for each reconciliation component, as well as face-up actions on the left, enabling us to add or reject those outside problems. What's nice is that even if we do decide not to incorporate those problems into the local record, we can always review those rejected or dismissed problems through our new filters. Seamless exchange can manage the heavy lifting of getting all the data to the right place at the right time, providing an intuitive interoperability experience for clinicians and a more cohesive healthcare experience for the individual, putting time and trust back into the health system. so doctors can focus less on technology and more on keeping the patient at the center of care.